Guys, let's quickly look at acute appendicitis. How this acute appendicitis actually, how the condition will basically look like in somebody that is young. All right. So acute appendicitis in the very young. All right. So this image actually shows symptoms, but this is basically some images that we'll use for what summary. Okay. So you could see that we'll talk about the problems, okay, of acute appendicitis in the very young. We'll talk about the common symptoms that are seen. We'll talk about the diagnostic challenges. We'll talk about the management and treatment, okay, and I think that will be all for the lecture. So, acute appendicitis in the very young, that's basically you talking about children who are under 5 years old. Okay, it's actually a challenging condition because you have tough times trying to diagnose. All right, you have tough times trying to diagnose this condition, trying to actually establish that okay, this condition actually exists. Okay, now it is challenging because you basically have non-specific symptoms, right? You have non-specific symptoms, and the children they can't really communicate. So they are not like adults that can tell you that okay, look, I'm feeling pain in my lower abdomen. Do you understand? They can't really communicate, so you have problems trying to get the history. All right. Then the appendix is even small size. All right. Like let me say a boy like this. How do you expect him to actually explain in details how he's feeling the pain? All right. And one thing is the ability of the patient to actually explain in details how the pain is will help you what make your diagnosis better. All right. So there's also high risk of perforation, and this is because why the appendix is what small size. All right. So what will be the symptoms of this acute appendicitis in the very young? Of course, there will be abdominal pain. The abdominal pain could be diffuse or localized. The child will be vomiting. You have fever. You have diarrhea and constipation. You have abdominal tenderness. All right. You have some muscle guarding. All right. And the child will also have some rebound tenderness. All right. The child will have some rebound tenderness. They're talking about the diagnosis challenges. All right. There'll be difficulty in obtaining what accurate medical history. And this is because the child cannot really communicate very well. Okay. There's also limited understanding of the symptoms, right? There's there could be normal appendix size and appearance in imaging, right? So appendicitis in children, sometimes you could just see the appendix is still having the same size, right? But it's actually inflamed, right? There's also likelihood of what misdiagnosis, right? You can actually miss your diagnosis. They're talking about the management and treatment. You can do an early surgical consultation, right? You could do some imaging studies like what ultrasound, or CT scan. All right. You can do appendectomy. Appendectomy is basically what surgical removal of the appendix. All right. Then you can actually give some antibiotics if there's a perforated what appendix or there's likelihood of it being perforated. All right. So you give some prophylactic medication to prevent what infections. Then you can also give some supportive care, right? Also give some supportive care. All right. So diagnosis may be more difficult to establish, right? And if you do some laboratory tests, you find out that the white blood cells are normal, right? Children are more likely to progress toward perforated appendix, and this is because the appendix is still a pea size. All right. So this is basically what all that is involved in what appendicitis that will be seen in the very young age group. All right. See you guys.